Coming to UF Health, I didn't know exactly what to expect. I'm originally from Denver, Colorado, and I had been to Orlando and Tampa, things like that, but I'd never been to Gainesville, where the home of the Gators are. When you walk onto UF Health Shands campus, I mean, you are blown away. You see these 3 beautiful towers, including our children's facility as well. But then you get the opportunity to do rotations at the VA hospital, which is phenomenal to be able to work with our veterans and to see a different style of hospital. And then if you drive just right down the street, we also get the opportunity to rotate at an outpatient facility, ambulatory hospital.
One of the best things that they offer here at UF Health is they do such an amazing job at recruiting residents. Everyone's always looking to help out one another. Everyone's always looking to make sure that you're okay. And I think whenever you do come to residency, some people are coming from further away than others. You might leave your main support behind, and I think the residents have done an amazing job at just kind of taking up that burden, if you will, of becoming each other's support.
I looked all over the country for where I wanted to spend residency and where I was going to get the best training. I walked on campus and one of our administrative staff members gave me a hug when I got off the bus. Never had met her, anything like that, and it was just so welcoming, and that carried out throughout my interview day. You realize how much not only your co-residents but your staff, your supporting administrator, and your attendings really cared for everybody that was there, not only in the OR but out of the OR too.
If I think of one thing that will summarize the culture overall, I call it a culture of safety. Like, it's very safe for the resident to talk to the faculty about different things. It is very safe to ask questions and get a response back. Even with the surgeon attending, I mean, it's really safe. In the OR, it's like, hey, what's going on? My blood pressure is this. So it's really that communication is very safe. You don't feel intimidated at all.
The atmosphere that they've managed to create between the surgeons and the anesthesiologists, it's such a collegial atmosphere between the two, and they encourage us to bond even outside of the OR with things like Christmas parties and things of that nature. So it's one of mutual respect.
One of the things that is really rewarding to me here as well is the incorporation of perioperative medicine and patient-centered care. There's a concept around that's nationwide that's about perioperative medicine and involving the anesthesiologist as a perioperative consultant, and this is really growing really fast at UF Health. And now the surgeon knows about the patients really well, not just about the surgical pathology. They know about their pulmonary status. They ask them about their heart status. They ask about different things and we talk about them every 2 weeks to make sure that we discuss the high-risk patients. So that's one of the things that I feel like UF is focusing on patient-centered care.
We work hard here, we do, and you learn a lot every single day in the OR. But at the end of the day, you've got support of everybody around you, and it's a family here at UF Health Anesthesia.